All right. Hi, Tony. Today we're gonna do a ankle range of motion inversion for goniometric measurement. So, are you okay if I touch you?
Yes.
Okay. So, first, I'm actually gonna stabilize your knee and ask you to move your toe toward my hand. Perfect. So, that's about 30 to 35 degrees, I'd say. So now I'm gonna place my goniometer on I'm gonna place the fulcrum at the anterior ankle between the malleoli, and then the proximal arm is gonna go up your tibia to your tibial tuberosity, and the distal arm is gonna be in line with your second metatarsal. And now I'm gonna passively move your foot into inversion. Okay. And your measurement is 36 degrees. So that's normal. The normal range is 35, so you have a little more. That's good. And it was a firm end feel, so that's normal. So good job. Hi, Tony.
Hey.
Today we're gonna do some range of motion for hip adduction for goniometric measurement. So I'm gonna ask you to lay on your back with your feet at this end of the table. All right. Oh, perfect. You moved as close as you can to the edge, so that's good. Is it okay if I touch you?
Yeah.
Okay. So I'm gonna move this leg out to the side, and then I'm gonna ask you to, while I stabilize your pelvis, let me just put this down. I'm gonna ask you to move this leg toward your other leg. Okay. Go. Okay. So you just moved a little bit, but it's okay. So I'm gonna line up the fulcrum of the goniometer with your anterior superior iliac spine. So I'll do the fulcrum on your right ASIS, and then it's across the midline to your other ASIS. And then the distal arm is going to be down the midline to your patella. Okay, and while I hold it here, okay, all right, I'm going to move your leg towards your other leg. Okay. It's a firm end feel. And you got 15 degrees of range of motion. So the normal is 20, so you're slightly lacking in your hip adduction range of motion. But you had a firm end feel, so it was good. So today we're gonna do a manual muscle test for trunk flexion. We're going to be testing your rectus abdominis, your internal and external obliques, so that's basically just your abdominal muscles on the front. I'm going to ask you to lie on your back with your feet at this edge of the table with your legs straight out. Is it okay if I touch you?
Mm-hmm.
Okay. So I'm going to ask you first to put your hands behind at your neck. Yep, right there. And I'm gonna hold down your legs so they don't elevate while you tuck your chin and lift your head, shoulders, and arms off the table to do a chin up towards me. Perfect. So I would give you a grade 5 because the inferior angle of your scapula, which is the bottom of your scapula, it cleared the table. For a grade 4, you're gonna cross your arms over your chest. And I'm going to hold your legs down so they don't elevate, and you're going to curl up towards me. Perfect. That would be a grade 4. Just cleared the table. Then for grade 3, you're going to have your arms at your sides, but slightly elevated. Perfect. And then I'm going to hold down your legs, and you're going to curl up again towards me. Perfect. That would be a grade 3. And then for a grade 2, you would have your knees flexed. So just flex your knees for me. I would hold you. You would have your arms at your sides. I would just hold your knees right here. and you would curl up towards me, and that would be a grade 2 because I feel muscle contraction and the rib cage depressed. Grade 2 would also be if I assist you with my arm behind your upper back in between your shoulder blades, and if I felt a muscle contraction and the rib cage depress. A grade 1 would be if you coughed and I felt a contraction, or if you didn't cough but I still felt a contraction, no rib cage depression. And then a grade 0 would be if I didn't feel any contraction and there was no movement or no. Manual muscle tests for knee extension. So I'm going to be testing your quadriceps muscles, which are on the front of your leg. So can you lie on your side facing me? I'm actually going to get on this side. Okay. Is it okay if I touch you?
Yes.
Okay. So I'm going to have you, oh, this is perfect. You're close to the edge of the table, so good body mechanics. I'm going to stabilize your hip, lift up your leg, and you're going to bend your leg, bend your knee all the way towards me, and then straighten your leg all the way. Perfect. So this would be a grade 2 because it's in the gravity minimized position. You went through full range of motion, or this would actually be a 2+. 2 would be if you went through partial range of motion. A grade 1 would be lying on your back. So lie on your back for me. And I'm just gonna put this underneath you. Just a little thick, but put this under your knee. I'm gonna ask you to push your knee into the blanket. And since I feel a contraction, this would be a grade 1. If you did this and I felt no contraction, this would be a grade 0.